Good morning. If chronic joint pain and morning stiffness are stealing your independence, I have 3 pantry foods that may change everything. I'm Dr. Adriana, and today you're getting turmeric, ginger, and cinnamon, with exact serving sizes, perfect timing, and a 7-day tracking plan that shows real results. These aren't expensive supplements. They're affordable spices sitting in your cupboard right now, and when used correctly, they may quiet the inflammatory signals driving your pain, stiffness, and loss of mobility. This is education only, not medical advice, and these foods complement, never replace, your doctor's treatment. So always consult your healthcare provider first, especially if you take blood thinners, diabetes medications, or have kidney disease, GERD, or gallbladder issues. Think of inflammation like a fire alarm stuck on inside your joints. Your immune system releases chemical messengers called cytokines and prostaglandins that trigger pain, swelling, and stiffness even when the original problem has passed. Turmeric, ginger, and cinnamon contain natural compounds that turn down that alarm by reducing inflammatory messengers, supporting joint tissue health, and calming pain signals. Most people notice reduced stiffness and easier movement within 7 to 14 days of consistent use. Let's start with turmeric, which contains curcumin, a compound studied extensively for joint pain relief. Take 1/2 to 1 teaspoon of ground turmeric daily. Divide it into 2 doses, always with food containing healthy fats like olive oil, avocado, or nuts, because curcumin is fat-soluble. Without fat, most of it passes through unused. Here's the secret. Add 1/8 teaspoon of black pepper, or just a few grinds, to increase curcumin absorption by up to 2,000%. Black pepper contains piperine, which blocks the enzymes that normally break down curcumin before it reaches your joints. A simple morning habit: mix 1/2 teaspoon turmeric into oatmeal or yogurt with olive oil and black pepper, or stir it into warm milk at night with honey for soothing golden milk. One common mistake: taking turmeric without fat or black pepper, which wastes your effort. Another: expecting instant results and quitting after 3 days. Turmeric reduces inflammation gradually, so you need 1 to 2 weeks of consistency to notice changes in stiffness or pain. Never mix it into sugary drinks. High sugar promotes inflammation and cancels your benefits. Now ginger, which clinical trials show reduces joint pain, decreases morning stiffness, and lowers inflammatory markers in osteoarthritis and rheumatoid arthritis. Take 1/4 to 1/2 teaspoon of ground ginger twice daily, or 1 tablespoon of freshly grated ginger total per day. Use it morning and evening. Morning to reduce stiffness, evening to support overnight repair. Ginger is incredibly versatile. Steep 1/4 teaspoon in hot water for 5 minutes to make tea with lemon and honey. Grate fresh ginger into stir-fries, soups, or smoothies. Sprinkle ground ginger over oatmeal or roasted vegetables. The taste is warming, slightly sweet, and most people love it, especially as tea. Important safety note: ginger has mild blood-thinning properties. If you take warfarin, aspirin, or clopidogrel or face surgery within 2 weeks, talk to your doctor first, because ginger may increase bleeding risk. Ginger can also lower blood sugar slightly, so if you take insulin or metformin, monitor your levels closely and discuss timing with your healthcare provider. People with GERD may experience mild heartburn from ginger on an empty stomach. If that's you, reduce your dose, take it with meals, or switch to gentler ginger tea. Third is cinnamon, studied specifically for rheumatoid arthritis with impressive results. Reduced C-reactive protein, tumor necrosis factor alpha, disease activity scores, pain levels, and number of tender swollen joints. Take 1/2 teaspoon twice daily, or 1 teaspoon once daily, for at least 8 weeks. You can split it as 1/4 teaspoon morning and evening, or take it all at once if easier. Cinnamon is sweet, warming, and effortless to use. Sprinkle it over oatmeal, yogurt, cottage cheese, or applesauce. Stir it into coffee, tea, or smoothies. Add it to pancakes or whole grain toast with honey. Cinnamon pairs beautifully with turmeric and ginger for a powerful anti-inflammatory combination. Make morning tea by steeping 1/4 teaspoon each in hot water with lemon, black pepper, and honey. If you have diabetes or take blood sugar medications, cinnamon can enhance those effects and potentially cause low blood sugar, so monitor your levels and work with your doctor. Cinnamon in very large amounts, especially cassia cinnamon from grocery stores, contains coumarin that can stress the liver and kidneys over time. The doses I recommend, 1/2 teaspoon twice daily, are safe for most people, but if you have existing liver or kidney disease, check with your healthcare provider. For extra caution, choose Ceylon cinnamon, which has much lower coumarin levels. Here's your simple daily plan. Morning. Make anti-inflammatory tea by steeping 1/4 teaspoon each of turmeric, ginger, and cinnamon in hot water for 5 to 10 minutes. Add black pepper, lemon, and honey, and drink it with or after breakfast so you have food and fat in your system. Lunch. Sprinkle 1/4 teaspoon turmeric and black pepper into soup, salad dressing, rice, or vegetables with olive oil. Evening. Make golden milk by warming milk or plant-based milk, then stirring in 1/4 teaspoon each of turmeric, ginger, and cinnamon, plus black pepper and a drizzle of honey. Drink it 1 hour before bed to support overnight tissue repair and reduce morning stiffness. You don't need rigid perfection. Rotate the foods through your week to keep things interesting and avoid taste fatigue. Some days focus more on turmeric and black pepper, other days ginger tea, other days cinnamon and oatmeal. The key is consistency. Aim to consume all 3 most days at the doses I described, paired with healthy fats when appropriate, and always with black pepper for turmeric. Store spices in airtight containers away from light and heat, and replace them every 6 to 12 months because older spices lose potency. Buy small amounts so you're always using fresh, powerful spices that deliver maximum anti-inflammatory benefit. Let's address one critical mistake that sabotages results. Many people buy turmeric or ginger capsules thinking they're easier. There's nothing wrong with quality supplements, but many cheap options contain little active ingredient, poor absorption, unnecessary fillers, or added sugars that promote inflammation. If you choose supplements, look for black pepper extract or piperine with turmeric, clear milligram amounts on labels, and third-party testing. For most people, especially on a budget, cooking with whole spices is just as effective, more affordable, easier to dose, and pairs naturally with healthy fats and anti-inflammatory foods like vegetables, whole grains, and olive oil for synergistic effects. Now alternatives for specific health concerns. If you have diabetes, you can still use all 3 spices, but watch portion sizes, skip honey or sweeteners in teas, and monitor blood sugar closely, especially the first week, because turmeric, ginger, and cinnamon can enhance blood sugar lowering effects of medications. If your blood sugar drops too low, talk to your doctor about adjusting medication doses rather than stopping the spices, because the anti-inflammatory benefits are valuable for people with diabetes. For diabetes-friendly golden milk, use unsweetened almond milk, skip honey, use stevia if needed, and take it with a meal containing protein and fiber. If you have GERD or sensitive stomach, ginger and cinnamon can sometimes trigger heartburn, especially on an empty stomach or in larger doses. Start with 1/8 teaspoon instead of 1/4, and always take them with meals. Try ginger tea from fresh root, which is gentler than powder, or switch to enteric-coated capsules that dissolve in your intestines. Turmeric is usually well tolerated for reflux, but if it irritates you, take capsules, or mix it into soothing foods like yogurt. You can also focus more on cinnamon and turmeric and use less ginger, or rotate foods so you're not consuming all 3 daily. If you have kidney disease, be cautious with any foods high in potassium or oxalates. Turmeric, ginger, and cinnamon in culinary amounts, the small doses used in cooking, are generally safe for mild to moderate kidney disease. But if you have advanced disease or are on dialysis, you must talk to your nephrologist or renal dietitian first. Your healthcare team can determine safe portion sizes and monitor kidney function. A safer approach for kidney concerns. Use very small amounts like 1/8 teaspoon once daily. Use them occasionally rather than every day, or focus on 1 or 2 spices instead of all 3. If you take blood thinners like warfarin, aspirin, or clopidogrel, be especially careful with ginger and turmeric because both have mild blood thinning properties that enhance medication effects and increase bleeding or bruising risk. Talk to your doctor first. Start with very small amounts like 1/8 teaspoon once daily. Watch for unusual bleeding, bruising, or blood in urine or stool, and have INR or clotting tests monitored more frequently the first few weeks. If you're scheduled for surgery or any invasive procedure, stop ginger and turmeric at least 2 weeks beforehand to reduce bleeding risk. Cinnamon doesn't have significant blood thinning effects, so it's safer for people on anticoagulants. An alternative, focus primarily on cinnamon. Use very small turmeric amounts without black pepper to limit absorption, and avoid ginger, or use spices only occasionally. If you dislike the taste or have allergies, try encapsulated forms for anti-inflammatory benefits without tasting the spices. Choose high-quality products with black pepper extract for turmeric and clear dosing information. You can also explore other anti-inflammatory foods like fatty fish rich in omega-3s, tart cherry juice, green tea, dark leafy greens, berries, walnuts, and olive oil. Find an approach that fits your taste, budget, health conditions, and daily routine, and stick with it consistently to see real results. Now your 7-day tracking plan to prove whether these foods actually help. Set up a simple system using a notebook, phone note, or paper on your refrigerator. Each morning and evening, rate your joint pain and stiffness from 1 to 10, where 1 is no pain and 10 is the worst you've experienced. Write the number with date and time. Note how long it takes to get out of bed or stand from a chair without significant pain. Immediate, 30 seconds, 1 minute, 2 minutes, write that down. During the day, pay attention to comfortable range of motion in joints that bother you most. Knees, hips, hands, shoulders, back. Can you bend, reach, or grip more easily than before? Or is it the same? At day's end, give yourself an overall daily comfort and function rating from 1 to 5, where 1 means you felt miserable and limited all day, and 5 means you felt comfortable, mobile, and able to do what you wanted. Write it down with notes about what you ate, how much turmeric, ginger, and cinnamon you consumed, and how you prepared them. On day 1, before starting these foods, record your baseline numbers. This is your starting point. Then begin incorporating turmeric, ginger, and cinnamon as I described, and continue tracking every morning and evening for 7 days. By day 3 or 4, some people notice small improvements like slightly less stiffness when getting out of bed or more ease bending or gripping. Others don't notice changes until day 7 or day 10. Everyone's body is different, and timeline depends on how much inflammation you're starting with, how consistently you use the foods, whether you pair them correctly with fats and black pepper, and what else is happening: stress, sleep quality, activity level, overall diet. If by day 7 you haven't noticed any improvement in pain, stiffness, mobility, or daily comfort, adjust. Try increasing serving size slightly, such as moving from 1/4 to 1/2 teaspoon of each spice. Make sure you pair turmeric with black pepper and healthy fats every single time. Spread doses more evenly through the day rather than taking everything at once. Consider whether poor sleep, high stress, or highly inflammatory diet full of processed foods and sugar might be overwhelming the benefits. If you do notice improvement, celebrate that win and keep going. Maybe your pain rating dropped from 8 to 6, or morning stiffness went from 3 minutes to 1 minute, or you opened a jar or climbed stairs without wincing. Those are real, meaningful changes that add up to better quality of life, more independence, and greater daily comfort. Write down your day 7 numbers and compare them directly to day 1. And if comfortable, leave a comment sharing your results. Day 1, pain, 8 out of 10, stiffness 3 minutes. Day 7, pain 6 out of 10, stiffness 1 minute. This sharing helps other viewers see what's possible, gives you accountability and encouragement, and builds a supportive community working together to manage inflammation and joint pain naturally. If your results are good after 7 days, keep going another week or 2 and continue tracking to see if improvements continue or plateau. Many people find benefits build over time, with the most noticeable changes happening in weeks 2 and 3 as anti-inflammatory compounds accumulate in your system and make deeper impact on joint tissues and pain pathways. Important expectations. These foods are not miracle cures. They will not reverse severe arthritis, heal damaged cartilage, or eliminate need for prescribed medications or medical care. What they can do is help reduce inflammation, ease pain signals, improve comfort and mobility, and support overall joint health as part of a comprehensive approach that also includes staying active, maintaining healthy weight, getting enough sleep, managing stress, eating a balanced anti-inflammatory diet rich in vegetables, fruits, whole grains, and healthy fats, and working closely with your healthcare team. Think of turmeric, ginger, and cinnamon as valuable tools in your toolbox, not magic bullets. Here's one bonus recipe that brings all three foods together in a delicious, easy form you can enjoy daily: anti-inflammatory golden paste. In a small saucepan, combine 1/4 cup ground turmeric, 1 tablespoon ground ginger, 1 tablespoon ground cinnamon, 1/2 cup water, and 1/3 cup coconut oil or olive oil. Stir over low heat for 5 to 7 minutes until it forms thick paste. Remove from heat, stir in 1 teaspoon black pepper, let cool, then transfer to small glass jar with lid and store in refrigerator for up to 2 weeks. Each day, take 1 teaspoon and stir it into warm milk, tea, smoothies, oatmeal, yogurt, or spread thinly on toast. 1 teaspoon provides balanced dose of all three spices with healthy fat and black pepper for absorption, and it's incredibly convenient because you've done the prep work. Double or triple the recipe for larger batches to save time. Let me recap your complete action plan. The 3 pantry foods that may help quiet inflammation and ease joint pain are turmeric, ginger, and cinnamon. Turmeric, 1/2 to 1 teaspoon daily, divided into 2 doses, always paired with black pepper and healthy fats like olive oil, taken with meals. Ginger, 1/4 to 1/2 teaspoon ground ginger or 1 tablespoon fresh grated ginger, divided into 2 doses, taken morning and evening, enjoyed as tea or cooked into meals. Cinnamon, 1/2 teaspoon twice daily or 1 teaspoon once daily, easily added to oatmeal, yogurt, coffee, tea, or baked goods, and pairs beautifully with the other 2 spices. All 3 work by reducing inflammatory messengers like cytokines and prostaglandins, supporting joint tissue health, calming pain signals, and improving overall comfort and mobility. Expect results within 7 to 14 days if you're consistent, use right doses and pairings, and track progress carefully. Consult your doctor before starting, especially if you take blood thinners, diabetes medications, blood pressure medications, have kidney disease, GERD, gallbladder issues, or any condition requiring medical management, or if preparing for surgery. Start with smaller amounts if sensitive, and adjust gradually as you see how your body responds. Watch for unusual bleeding, bruising, digestive upset, allergic reactions, or worsening joint pain, and stop and seek care if those occur. Use the 7-day tracking plan to monitor pain, stiffness, mobility, and daily comfort, and adjust by day 3 or 4 if not seeing changes. Celebrate small wins, share results in comments to help others, and remember these foods complement, never replace, your medical care and prescribed treatments. If you found this helpful and want more practical, evidence-based guidance on staying healthy, strong, comfortable, and independent as you age, subscribe to Dr. Adriana Senior Health and tap the notification bell. I'm here to give you clear, respectful, actionable information that helps you take charge of your health with confidence and dignity. Thank you for being here, and I look forward to supporting you on your journey to better joint comfort and a more active, pain-free life.